Okay, first of all, thank you all for coming. The media serves a very important role in getting the information out to the public at this unprecedented time for our region and our city. I've been meeting with you now for a couple of weeks, anticipating that with every day there's going to be new developments. Yesterday, as you know, we announced our intent to reduce our workforce by 50%. Things are changing by the hour. Today I'm announcing that City Hall is closed to anything but absolute essential emergencies, and the city operations are closed to anything but anything to do with health and safety. There's a policy to maintain minimum staffing across the city for emergencies, but I'm asking all of our emergency and first providers or emergency providers to be on 24-hour call. Our fire department is fully staffed. We put in place a second ambulance. We're especially concerned about the nursing homes and extended care facilities on the south side of our town, make sure that those individuals and those residences have the quality of care and the access to the healthcare system as best as possible. Same with the police. They're instructed to come up with any procedure necessary to maintain the public safety. Often first responders include the police because you know they can be there in any location within a couple of minutes, and that's very important at this time as well. We're maintaining the safety of our water supply and wastewater treatment facilities because we believe that's an essential health and safety issue as well. All other staff are instructed to stay home. Many are able to work from home, so much of our operations, including helping with even as something as mundane at this time as paying bills, etc., can be conducted online or from home, and we'll be doing that as well. I will be here. Anybody who needs to have an essential emergency service in City Hall, I'll be opening doors for them, and we'll be taking care of any essential needs. The Common Council will decide for themselves whether they wish to cancel or not, but we've all figured out a way to deliver all of our political and administrative services via the internet through video conferencing, etc. So I would imagine that they were going to be meeting through a video conferencing technique called Zoom that is now installed. Essential personnel that are able to work from home are being provided with laptops and the ability to access their work computer from home, and of course with telephones so they can maintain all those operations as well. And our goal here is to provide all the essential services of the city in some way that doesn't require face-to-face personal contact, except obviously with my safety team, my first responders here. We're going to maintain all the critical operations of the city. We're asking people again to work with us and have patience as we try and deliver all of our services as best we can at a distance, and that's going to require some patience, I'm sure, but all essential services will be provided. Anything to do with the health and safety of our residents will be provided as well. Some of our employees have asked if they will be getting paid as they stay home. This is a health and safety concern first and foremost, but of course their livelihood is important to us as well. And if we wonder whether that's sound economics, we're talking about saving lives at this point, but we need them to maintain their livelihood as well and keep their families safe at the same time. I asked the public to look at the best practices from the CDC, and in the press release I give you a link for best practices, which I should tell you are changing almost by the hour at this point. The goal is to absolutely minimize the number of social interactions we all have. If we can reduce the number of people you interact with each day from 30 to 3, we can reduce the rate of infection by 90% as well. So that's our goal here. Ultimately, many people in our region are going to receive this virus at some time or another over the next year or two. Most people may not even know that they've been infected, especially young, healthy people. Symptoms for some people are more mild than the common cold. We're worried about the most vulnerable population, anybody over the age of 60 and anybody with a compromised respiratory system. And certainly we're very worried about people with compromised respiratory systems who are over the age of 60. So we're trying to ensure that this virus spreads as slowly as it possibly can, so we can take care of our people who really need the help with with what I believe is going to be an overswamped healthcare system. So our goal is to, as you've been seeing in all the media, our goal is to lower and broaden the peak of infections over a much broader time. So this is not going to end in a couple of weeks, but we can certainly do a lot of things very dramatically in a couple of weeks to reduce the spread of the virus. And that's what we'll be doing by asking our workers to do things in a different way in the meantime, and asking our first providers to step up and assist the community in that. I can take any questions, and I've got my emergency services team here as well to answer any questions.
Why are you deciding today to close City Hall?
Well, to be honest, there's a dearth of good advice on this right now. I'm watching the CDC guidelines. I'm carefully monitoring the actions of the governor's office. There's a lot of things that a city can do that are within my control. I believe and trust that this is within my control. And so I'm acting until we hear otherwise from other authorities as well. I do ask the public to also consider these actions in their own places of business, their own employers, etc. I think it's prudent to do whatever we can to deliver the services in our economy, but do so in ways that require as little face-to-face interaction as possible. And as you know from the governor's executive orders, we do recognize that people's access to food and shopping and groceries and prescriptions and even home delivery of food, these are essential services, and I really appreciate our business community to step up to the plate as well.
So what is the day-to-day like for our first responders, our law enforcement? That's kind of, are you making it so that way it's like less people in the building, like a lot of places are doing, or are you reducing staff for this time?
We're actually, for some of our first responders, we're actually increasing staff. We're moving to maximum staffing levels, for instance, for the fire department, so they can operate a second ambulance at all times. The police, I think, is going to be an as-needed basis, but the police are determined to make sure that in any situation they've got the staff they need to get the job done, including calling in staff at any time and asking everybody to be on 24/7 notice.
So are you just trying to reduce people like in the building? I don't know if maybe I'm
Our only goal here is to try to reduce face-to-face contact, because that's obviously the way that this virus spreads, without reducing the public safety in any way. As a matter of fact, in some sense, we're enhancing public safety because we're really requiring our first responders to be absolutely fully staffed and able to work. And fortunately, you see there's not that many people on the streets right now, so we're giving them the best opportunity to respond to emergencies as quickly as they possibly can. Would you folks like to add anything?
I would just add that prior to seeking going to any medical facility, that you call ahead and make sure that you're speak to somebody so that we aren't transporting sick people that don't need to go to a healthcare facility to the healthcare facility. You can go to the Clinton County Department of Health website and they will give you guidance. So please follow that so that we aren't transporting people that could actually stay home and self-medicate and get better. Obviously, if you have life-threatening issues, definitely call.
Can you talk a little bit about just cleanliness at the station? I know we spoke about it a few weeks ago, but just about protective gear and wiping everything down.
Right, we wear bloodborne pathogen gear. We do that all the time. Our sanitizing has dramatically ramped up above and beyond what Department of Health requires. We are sanitizing our ambulances fully between every call. We have fogging machines that are on order. We also have the ability to use them from the hospital to put them in if we have a contamination issue. We're working collectively with them. At the stations, anything that's touched is sanitized daily, and now we're going to move to twice a day so that we keep our professionals healthy so that they can respond and help you.
Kiefer, can you talk about what safety precautions are you talking? Any gear? Are your officers out
So that's what my plea would be to the public in our jurisdiction, is that please be patient with us, because one of the things that we're going to try to do is screen people when they call for police service, or when they come into our station, they'll be screened, per CDC protocol. And it's going to be a little weird for people, expecting crisis response, but we also need to ensure that our police officers are safe. Not that the safety of other people is not important as well. It's so we are both working in conjunction with the best practices. So another thing would be to let people know, you might see police officers in N95 masks in certain scenarios. And it's not a call for alarm, it's just being protected is all.
And I think the chief makes one very important point. We don't want the public in any way to panic. We're doing all this to prevent a much more serious situation. So we think if everybody is calm and responds by minimizing the level of social interaction in the City Hall, obviously is doing our bit to do that, we can keep the public safe. So if a first responder is responding with masks, etc., they're really doing that to try to keep the public safe. They're probably required to have more face-to-face contact as first responders than anybody else in the public, and they're being drawn into situations that could be that potential person needs to be transported. So their health and safety will translate into the health and safety of all the various members of the public they may be contacting subsequently throughout the day. And so we're trying to make sure that they stay safe so everybody else can stay safe at the same time. So what I think we can do if we actually follow these procedures is ensure that the infection rate in Clinton County is as low as it possibly can. That's what we're trying to do to make sure people don't get infected rather than panicking because too many people have become infected. We're trying to stay ahead of this, and I think if we do stay ahead of this, we won't have the level of incidences that you're seeing in some other communities, especially communities downstate.